mantle cell lymphoma is a very distinct subtype of non-Hodgkin's lymphoma, and patients tend to be elderly. The median age for mantle cell lymphoma patients is over 65. So many of them may not be able to tolerate chemotherapy. But I think most importantly, chemotherapy to date has not been shown to be a curative option. So I think the objective should be try to prolong survival for patients. In the meantime, also try to preserve their quality of life and also allow them to have a normal, productive life. There are actually quite a few new options for treatment of relapsed mantle cell lymphoma, as you know. There are currently 3 biologics available on the market. The first was the proteasome inhibitor, bortezomib. This was followed by lenalidomide, which is a immunomodulatory compound. And most recently, we also have a specific kinase inhibitor, ibrutinib. There a few studies that has shown clinical benefit for lenalidomide in patients with mantle cell lymphoma, particularly in the setting of relapse disease. For example, there is a large phase 2 registration study for patients who had relapse lymphoma, which showed about 30% overall response rate for lenalidomide as a single agent. There's also a phase 2 study which evaluated the combination of lenalidomide plus rituximab. In that particular study, I believe the overall response rate was close to 60%. So I think those studies formed a fairly concrete base for our study hypothesis and potentially pave way for its feasibility.